Thank you, Vuyo. We all have been concerned about the pace that this project to attend to the remedial work following the fire that broke out last year, in April last year. You all know at any given time the Premier has expressed his concern at the pace that this project was taking. He has also had representations from various interest groups, including the clinicians who work in the hospital, who are all concerned about the patients that they have to care for, and the fact that the facility was taking too long to come back. And there were also other interest parties who have all raised their concerns. We all know about all of that. And as I said, at any time the Premier has received briefings from all the departments, especially this work was undertaken by the Department of Infrastructure Development and the Department of Health. And of course, he has also been receiving briefings, regular briefings from the hospital management. With all of this, late last year, we then, having looked at the slow pace, the Premier instructed the heads of department of both infrastructure development and the Department of Health, the Department of Health in particular, to look at all options of fast-tracking this project, but he also gave a strict instruction that whatever option that we look at, we must act within the PFMA and all other law that governs how we procure services. He was saying this because he did not want to see a repeat of what happened in 2020 when we started the response to COVID-19. Let me also share with you that, so as we were looking at all these options, in December we received a report from the SIU. And that report said to us that there are a number of senior officials from the Department of Infrastructure Development, as well as the Department of Health, who were implicated in wrongdoing in the appointment of contractors for the refurbishment of the Anglo Gold Ashanti Hospital in the West Rand, and of course other indication are that even the other work or investigations that the SIU is conducting might reveal that there was wrongdoing by the same officials. So we did announce last week that 9 officials were suspended. Now, I'm mentioning this because as we were dealing with the delays in the completion of the work, the remedial work at Charlotte Maxeke Hospital following the fire, we also had to deal with this issue, which would obviously impact on our capacity to deliver on this project in the shortest possible time. One of the problems that led to the delays was that there was no agreement between the Department of Health, which is a client department, and the Department of Infrastructure Development. The Department of Health did not agree on the scope of work and the budget that was proposed by the Infrastructure Development department. And I had to step in and mediate from the Office of the Premier. And even that was taking too long to resolve. And that is why in December, we then decided with the Premier that we should look at other options within the law, of course. So that's what brought us to the Premier then making a determination that he was going to transfer the function of this hospital, Charlotte Maxeke Johannesburg Academic Hospital, from the Department of Infrastructure Development to the Department of Health. This would then enable us to look at all other options to fast-track the project. Now, we did that, and on the 9th of February, the proclamation was gazetted, which allows for the transfer of the functions entrusted by Section 13(1), read with the definitions of accounting officers and custodian, in Section 1 of the Government Immovable Asset Management Act, GIAMA, Act 2007, Act number 19 of 2007, in respect of Charlotte Maxeke Johannesburg Academic Hospital, from the Department of Infrastructure Development to the Department of Health. So the Premier signed this proclamation, and as I said, it was published in the Government Gazette on the 9th of February. And once that was done, it then enabled us to implement the options that were chosen. And I want to emphasize what I said earlier. So in the proclamation, the Premier says, the said transfer is exclusive and limited to the remedial work to be carried out expeditiously within reasonable timeline and cost under the authority of the member of the Executive Council for Health in strict compliance with the Public Finance Management Act, Act number 1 of 1999, to restore all or full services following the fire incident which occurred during April 2021 at this hospital. That's the instruction from the Premier to the MEC, and this is in a gazette. With that having been done, the department, as I said, then had to look at the options. And one of the options was to say, let's work with the national department. So we then, of course, in the period leading up to the proclamation, we had been engaged in discussions with the Minister of Health, Dr. Patla, and the Director General about what we can do together to fast-track this project. And we then agreed that because of the issues of capacity that I raised earlier, it would be best to allow National to play more prominent role in the project. So the project will now be led by National. Mr. Dakela will be the lead, will take leadership of this project, the implementation of the project. And the department has also appointed the DBSA to be the implementing agent. All of this we are doing in order to fast-track the project. And having said this, I will now invite Mr. Dakela to just briefly explain to you what he will be doing together with the DBA, of course, with the assistance of the DBSA, to ensure that we fast-track And you will see in his timeline, we are indeed going to fast track. So most of the work will be completed in the shortest possible time. Of course, ensuring that we don't compromise on the issues of safety. So I'll swap seats. We'll speak from there.
Yeah, you can swap.
No, we can swap, yeah. Okay. So Mr. Maxeke will explain to you.
Thanks, DG. Okay, thank you very much, DG. Mr. Dagela. If you can just repeat not all your full credentials, because it might take us
long. Thanks, DG. Thanks, Program Director. My name is Ayanda Dagela. I'm the head of infrastructure within the National Department of Health. As the DG has indicated, my role is to ensure that this facility is fully functional within a short space of time. I'm going to indicate what has happened during the last 2 weeks or so. We have done an assessment. We have conducted an assessment. We walked through the facility. We have checked out the areas where the fire has caused a lot of damage. And also what we have done also, we have identified also the areas that requires urgent attention within the facility. And those issues that we have identified are issues that are related to compliance issues. What do I mean by compliance issues? We are in a space where it's regulated by the Occupational Health and Safety Act. We wanted to make sure that we identify those areas to make sure that we comply accordingly. We have also identified areas where they are related to structural issues. And I must also emphasize that we have developed a project plan that has been given to both the Minister of Health and also given also to the Premier of the province. And within that project plan, I have covered the items that can be done immediately. What do I mean by items that can be done immediately? We have parking bays here that were affected. So we wanted to make sure that those parking, I think we have seen the facility, most cars are parked outside. So the plan is to make sure that I developed staff to within the facility in the meantime while working on the structures of the building. And we have identified, as indicated, that there are structural issues that are supposed to be attended to. They are also part of the project plan. So these structural damages that are supposed to be looked at, they are within Block 1, Block 2, Block 3, and Block 4 and Block 5 of the facility. So we have a plan that talks to those to make sure that we sort those out as quick as possible. And the other item that is covered also within the project plan, you know that the facility, the building, the facility, the health facility cannot work without health technology. Just to explain for those that do not understand what is health technology is the medical equipment that the facility are using in terms of saving lives. So there were certain equipment that were affected. So the plan is to make sure that we analyze those equipment that were affected and make sure that if there are manufacturers around, and make sure that those manufacturers, they can come and make sure that those health technology equipment are ready for the installation, for when we are ready with Block 1, Block 2, Block 3, Block 4, and Block 5. We need to make sure that the equipment is also ready. So there is a team that is also within my office that is also looking at that item alone. There are also maintenance needs that are supposed to be covered for the facility. those maintenance needs, they also form part of the compliance issues that were identified by the City of Johannesburg. So the aim is to make sure that we attend to those maintenance needs. They are also form part of the project plan. We are intending to complete the package before the end of 2023, which is next year, to complete the whole thing. I think the initial arrangement was 2027, but I'm planning to fast track everything. The approach is going to be an accelerated approach where milestones will be flowing parallel to make sure that we cover as many items as possible within a short space of time. I've done my part. DG, can I hand over to you?
All right.
Mr. Tagala, DG,
Yes, let's allow. Then she will invite the
conditions.
yes.
Good morning to everyone who is here, and welcome to Charlotte Maxeke Johannesburg Academic Hospital. My name is Gladys Bokoshi. I'm the CEO of the hospital. It gives me great pleasure today as the CEO of the hospital, who from the 16th of April, we have been battling to try and look after the patients that we have been looking after for this time. We are elated that the Premier has taken the step to fast-track the fixing of the hospital. We are operating with some restrictions because of what has just been explained, and we are aware that some of our patients are still battling, but we do look after them in the different facilities where they go. Yes, there is a problem with parking, and we're also very elated that the parking will be addressed as soon as possible. Because if you look in the health department, the most important resource is the human resource. So we really are elated that our staff will be cared for in terms of ensuring that they park in a safe area. We have been having many discussions with Mr. Dakela since he came here 2 weeks ago, as he said. He's engaged us as management, but he has also engaged with the clinicians. And in the room, we have Prof. Miyang, who's going to represent all the clinicians. But fortunately, again, he's the chairperson of the Medical Advisory Committee for the clinicians and the head of the Disaster Committee. So he's wearing both caps, and he is going to try and explain, as Mr. Dakela said, we're trying to fast-track the remedial work. Just to introduce the subject, we have 5 blocks in the hospital, even though the building looks like one. And so the plans that we are putting with Mr. Dakela is to find a way of moving, maybe doing more than 1 block at a time, to be able to run some services to a certain extent while the remedial work is taking place. And so what's important is that as we hand over the block, you know that this hospital is a highly specialized hospital. It's got 100 ICU beds. It means we will have to move patients around to those areas. So the clinicians are meeting regularly to see how best they can accommodate them in the smaller area that we will be occupying while the work is continuing. And so I'm going to ask Prof. Miyang just to briefly at high level to indicate how he intends, with the clinicians to do this. It's not a complete plan, as you heard. It's only 2 weeks that they have been here, but we have engagements on a daily basis. Thank you.
Good morning to everybody, and to the DG and the MEC and everybody here. Just to say, I think the DG initially made it quite clear that all of us are very frustrated from a clinician perspective point of view in terms of the time and the delay for patients' care, the implications to our healthcare workers, as well as obviously the secondary issue in terms of the academic implication of the delays in terms of the teaching and the importance of the continued care that is essential. I'm not going to waste time around those issues. I think they are quite clear and they have been articulated before. From the clinician's perspective, obviously, our main focus is about patients' outcomes and patients' care. And what we've done, despite all of these issues, even 10 months down the line, was to at least make sure that some of the outpatient care and the outpatient services are reinstated. Even though we've lost some of the internal and the beds in the institution, we've been able to bring some of the in-hospital care. Again, we need to do that within the framework of safety. But what we have also made clearly from the beginning was that we needed to make sure that as we offer the services to the vulnerable in our society, we also make sure that we are prepared to make necessary changes so that there can be ongoing remedial work. So we've already had plans that were instituted, and some of them will be unlocked as we move further. But we've already had plans to make sure that whenever we are looking at evacuating a block so that the fire remedial work is done, we are able to do that. We've got the 3 modules that we are looking at, one for partial evacuation of one block, the other one relating to the whole block that's moved, and another one for at least 2 blocks so that remedial work is done. But our commitment to make sure that the OHS, the training of our staff, to make sure that the fire training, the emergency work has to be done, all of that work is also on the pipeline, and we are making sure that as we are having more and more facilities and areas of the hospital made ready, we are ready to kick in all of those plans for the safety of the whole patients as well as our health care. So you can imagine that if we look back now 10 months down the line, what we having the radio oncology that is working to some reasonable capacity. We are hopefully going to have our emergency departments functional from the mid of March. That will mean 11 months down the line, our EDs will finally work. And you can understand why this new approach and this new change is at least giving us more hope, because I think for most of us have been frustrated up to now. And we're really looking forward to the implementation of this comprehensive parallel run system to try and deal with all of those issues that we've highlighted before. The parking, the more work in terms of the remedial work, the issue relating to making sure that at the end of the day, we've got more safety and this whole hospital is brought to the appropriate level. But I must say our frustration is that we really wish that this could have happened a lot sooner for the sake of those in this service that we are offering service to. The implication and the pressure on the whole system is undeniable, and I'm not going to waste time around the implication to the whole Gauteng health system. But we are really hoping that as much as we are, we've had lots of meetings up to now for most of us, we really would like to hope that this new energy and direction will actually end up with results. And those results is what we're going to look forward to, so that we don't lose more of our staff that we've already lost, that we don't have our patients suffering than they have already suffered, and that we don't end up with our healthcare workers exposed to all of these issues, including parking and mental issues and pressure that is being exposed to this problem not being solved in a long time. So yes, DG, we really are hoping that this is a new turning leaf, but we are really looking at it to hope and look forward to that really being seen in tangible and real experience that can be positive for the rest of the hospital. I think I'll leave it at that stage. Thank you very much, Teju.
Thank you very much, Prof. Thank you very much for that. I'll then now invite the MEC just to also do the reflection, and then I'll allow you colleagues to then ask questions. MEC? Go. You must know the level of the meeting.
we good to go?
Okay.
Thank you very much, Avuyo, and good morning to colleagues and colleagues from the media. I'm not going to be long because I think a lot has been captured by the DG and the CEO and Prof. Muyeng. From my side, I can say I'm happy that the Premier did this intervention because we had been coming to this boardroom almost for the whole year. When you go out of here, you have hope that things will move, but unfortunately not. And I'm also encouraged and by the support that National has provided to us and will continue providing to us, including financially as well. And also encouraged by Mr. Dagile when he was saying as they finish the blocks, they will be able to hand them over to us. So what it says to us, it means that the pressure that other hospitals have been feeling, your Edenvale, your Helen Joseph, at least it will be minimized and will be able to be providing other services. Without waste of time, Avuyo, I think we'll be ready to take questions. Thank you very much, because a lot have been said by our colleagues.
Thank you very much, MEC, DGCO, Prof, as well as Mr. Dagela. Colleagues, let's then take questions from yourselves. Just say who you are and where you're coming from, and then you can shoot the question, and then also where you are directing your questions. Okay, ma'am, you'll be number one. Okay, I think it sounds as if it was quite clear. Oh, okay. Next, you'll be number two. Okay, so we've got three questions. So how you assist me? Please come to me. Chan, just so that you can.
When you see the spotlight, I just want to find out, obviously 2 months down the line, we still haven't answered the question about who is accountable for the fire happening in the first place, about why we're sitting here at this point. Any answer to that, just on the accountability issues? And then also, if somebody could just tell us the actual budget we're looking at by the time we get to the end of 2022.
Okay, that's fine. Please come in.
Morning, everyone. Norman Zuma from the region. I was also going to ask on the budget question, what was the initial budget, and by the time you guys are expected to finish, what are you looking to have spent? And also, just in terms of the delays, if one could get a refresher, when was it expected to be completed, and when would the next, the first one to be finished, expected to be completed?
Morning everyone, Nosibo from IFM. Just on the issue of clinicians, so there was mention that some staff have been mentally affected by the closure and not being able to provide health services. Can you just get some clarity on the impact that has had on staff? Do you know how many people, doctors and nurses have left as a result of the closures?
Okay, thanks, Musa. Chan, you're fine. Okay, that's fine.
That's
fine. Let me hand it over to you.
Okay. I think the CEO and Prof. Muyeng will deal with the issues of the impact on clinicians, on staff. The cause of fire, we also are eagerly waiting for a report on the investigations that are conducted. You would know that when fire occurs, there are institutions that have to conduct such investigations. It can't be us as government because it is our building, it is our facility that got banned. So the authorities that investigate include the city and the police. So that question would have to be directed to those authorities. As I said, we are eagerly awaiting that report so that we can know what caused the fire and if anybody should be held accountable for that, we can then take necessary steps or appropriate action to hold such people accountable. The budget, Mr. Dakela has only been to the project for about 2 weeks. I think it would be fair enough to allow them to do a full assessment so that they can determine how much this would cost. There's some work that already has been done with the help of the Solidarity Fund, and other work is continuing also. I don't know if the CEO has the amount, the value of the donation from Solidarity Fund, because that we can say. But yeah, the rest, we will allow Mr. Dakela and the team from DBSA to conduct a full assessment, and then they will be able to tell us what the budget is. But all I can tell you is that it will be, so if you go back to what I read, the instruction from the Premier is very clear to everybody that we don't want to overpay. That we are going to follow very, very strictly. We come from a situation here where, if you know the report that I referred to earlier from the SIU, revealed that we spent in excess of 500 million on the refurbishment of a hospital which is still not being fully utilized. The Anglo Gold Ashanti, we don't want a repeat of that. So everybody is clear about that. But as soon as the full assessment has been conducted, Mr. Dakela would be able to provide the estimates of what this project would cost. I don't think he's ready to do that now. So yeah, that's how we will respond to the issue of the budget. Then the rest of the questions will allow the CEO to deal with, and of course, Prof. Moeng, if the CEO decides.
Again, thank you very much for this opportunity. Maybe let me start with the budget in terms of what the Premier has talked about. As I mentioned in the beginning, that the hospital has got 5 blocks. And so the donation that was done by Solidarity assisted us to do block 1. And when they started, they committed 68 million to do block 1. But as we were talking with them, as Premier has said, as you do work, then you find other faults. Remember, some things were off for a long time, and therefore they end up broken, or when you fix them, they don't fit with the new technology that you are bringing in. So they are busy calculating the extra money that we need to do the rest of the block 1. But what was critical about the donation of Solidarity, it gave us an opportunity as health to actually look at the way we can ensure that facilities meet the requirements of all the regulations. And we are very happy that our HOD gave us an instruction to develop what we call a legacy project. And we are using the Block 1 Solidarity input in terms of trying to write down how you should do a renovations, because you will recall that the regulations about build, fire, and OHS over the years has changed. In fact, when one of the things that we are doing as we were having COVID, there were new regulations about putting HVACs. So when we then asked Solidarity in our casualty already, they have applied the HVAC, the new HVAC system, to ensure that we don't only comply to the old regulations, but even the latest that came now through COVID. So, and the advantage of this, as the Premier has said, is that they are really managing the finances, and we are happy the way they report to us. And so that will give us some form of estimate, because all the blocks look almost similar, except you will find that maybe one block has got more ICUs, or there's a radiology department. So those will be the variations that we are expecting. But the wards, most of them look almost similar. When you go to the south, it's mainly theaters in some areas. Therefore, the costs will be a little bit different. And so with the writing of the legacy project, as Prof had explained, that they will finish casualty end of this month. Hopefully we will be able to move in. Then they will do the rest of the block. By the time Mr. Dakela comes in, we would be having sort of a much better idea in terms of how much is going to cost us and how to do it to ensure that even the COVID-19 regulations are in. The second issue in terms of the budget, there were some aspects of OHS that the hospital has done over the years in a slow process according to the budget that we had. And so Mr. Dakela looked at the documents and has quantified that. And that's why it's not possible for him to give the costs, because then he needs to look at all the things that we had already done before and subtract that, subtract what Solidarity has done, and even some of the things that are still in process in terms of us as the facility trying to fix them. Now, coming to the staff, I want to put it in its correct context. You will recall that COVID started in 2020, and Charlotte Maxeke was the only designated infectious disease hospital in the whole country. And so when COVID started, the first public sector patient was admitted in this hospital on the 7th of March, 2020. And with that, we had many patients who were very, very sick who came in here, including our staff. And so we are sitting with a situation where we have staff that contracted COVID and ended up having long COVID symptoms. We are sitting with staff who lost their loved ones and their mental health is not okay. But now this was compacted by the fire. So with these two, we really had a very high attrition rate that we are unable to quantify how many left because of the fire only, because there are those who left because the exhaustion and the strain and the loss of their family members was very difficult for them. But definitely we can confirm that we have lost a lot of very specialized staff and a lot of those who were really making this hospital to function properly. And so we are in the process of trying to retrain. But as you know, a health worker takes many years to be able to get them to a level where they could be doing this highly specialized work. So I'm really very grateful of my nursing director, Ms. Pule, who has already put programs to try and train those who are still here. But they are not only training for Charlotte, they are also training for the cluster hospitals who refer to us, because that's where some of our patients are. The clinical director and Prof Mieng and most of the heads of the departments are really trying to upskill the new staff that we are getting. The last thing that I want to say is that you need to know that the health workers are a highly mobile a group of people who have many opportunities sometimes. So when you look at it, perhaps maybe one day we might be able to analyze, I'm not promising, that, you know, how many left because of the fire. I don't know if it's possible, because remember there were these two things happening at the same time, the pandemic, the COVID, and one would have led to the other one and all that. But we did see a high level of attrition of our staff. And it's sad for us, but we are hopeful that we will bring back the hospital to the level where it is. Thank you.
Thank you very much, CEO. I don't know if colleagues. Okay. You will be number 1 on this round, number 2. Okay, follow up. Okay, number 3. We've got 3, no? Okay.
Just for clarity, so in 10 months we still don't know what caused the fire. Why is it that way? Especially because Dr. Maxeke, you said there's a lot of people who've been investigating this. You've roped in a lot of investigators. So why don't we know what caused the fire after 10 months? Secondly, how has this affected not only Johannesburg, but the entire province and the entire country, looking at how big Charlotte Maxeke is in supporting the country and some of the countries in the continent, because it's also a referral academic hospital. So how has this affected it? And then just for clarity, with the 68 million donations, CEO, what has it, when you say that other issues arise, do you mean that the 68 million was used and then you realize you needed more because of the issues that arise? And some of the issues that are arising, do they have to do with the COJ compliance issues that they flagged about the hospital?
Human resources, you say that there's been a high level of attrition. Could you perhaps let us know what you mean by that? Have you lost majority specialists for the layman on the street, or is it nursing staff? Is it support staff? What are the percentages? And when you say you plan to get them back, what are the plans and how are you planning specifically? We know that the intake of students, if I can call them that, would be the practicals. Some have indicated they're not willing to come. How are you going to mitigate that?
Thank you very much for it. Any follow-up?
I really want to find out about the pressure on especially psychiatric and mental health patients on the other facilities. We're also hearing things that Britain, for example, is really struggling to find beds for patients, up to 5 times their usual intake, I believe. And then I hope if you could please address the issue around the systemic problems around our healthcare, because obviously we're talking a lot about even this communicating what's going on to the public. This is probably the first proper communication. Our emails don't get answered from the various departments. I think it is a problem when we're not communicating about something that is a vital institution in the city. And then also, if you could just speak, I know you've spoken about the SIU, but when we look at things like all these things swirling around corruption within the department, especially infrastructure development, and what's actually been a block to actually get this hospital done. Could you just comment on that and where that leads us? Because obviously just saying the city of Joburg and police and waiting lists, but still waiting is really, I don't think that really touches. Because we really need to know why the hospital didn't have smoke doors, why the hospital didn't have working fire hydrants. That is not a city of Johannesburg or police jurisdiction. I'm sure it lays with the hospital or Department of Health or Infrastructure and Development.
Okay, thank you very much. What do you about it, TJ? You will take some, and then I think against you. Would you like to feel some people should teach you?
Yeah, I don't know whether the Dr. Zungu might also just want to speak on the more general issues about healthcare which were raised, because it's not just about Charlotte. Investigations, Marcel, it's, as I said, so the fire broke out here in the hospital, which is a facility that is owned by the Gauteng provincial government. So we would have loved to investigate, but we can't investigate ourselves. It is only proper that you allow the institutions that have the authority to conduct such investigations to investigate and then tell us what happened. And that includes the issues of the fire hydrants and so on. Why were they not functioning? The fire doors. All these issues about OHS. Somebody will investigate and then say, this is what we found. But what is priority now? Priority is to get the hospital back into full service. And that is why we have taken the extraordinary steps that we did, which the Premier did, to get the capacity to fast-track this project. And I'm not saying we are not interested in knowing what caused the fire. We are. But we cannot investigate ourselves. By saying we cannot investigate ourselves, I'm saying because we don't know. It could be that somebody in this hospital might be responsible, but let's allow those institutions that are competent and with authority to conduct the investigation and tell us what happened. And as I said, as soon as they give us the report, and if they say, according to their report, there are fingers pointed at certain people, we will take appropriate action. So yes, we do want to know what caused the fire. But let's allow the institutions that are investigating. One of the problems, of course, was that the block that was damaged could not be accessed for quite some time. I don't know how many, when we were able to put in the props there, CEO. But it was only after the propping was done to stabilize the structure, so the police could not access it immediately. But they have now been able to do that, and I'm sure they will be able to indicate to us how far they are with their investigations. And of course, from the side of the city also, they also do their own work, investigations, when fire breaks out. So for us, our preoccupation now is to get the hospital to full service. And that's why we are doing what we are doing. So, yeah, the other questions, as I said, the impact on the other services, the CEO will speak about that, but the Dr. Zungu will also speak about some of these things. You asked a question about issues arising. Let me just indicate the amount, the value of the donation is not the budget for the project. Because as I said to you, Mr. Dakela is going to conduct a full assessment, of course, including the work that has already been carried out. And that assessment will enable him to determine what scope of work still needs to be done and how much money that would cost. So it will probably be a lot more than the 68 million which was donated by the Solidarity Fund. And we really appreciate that donation because it has enabled us to fix some of the sections, including the radiation oncology building. There's work that is going on now as part of that donation by the Solidarity Fund. So you will get the full cost, and well, that will be an estimate based on the assessment. And I really want to appeal for your patience to allow Mr. Dakela to conduct that assessment with the implementing agency that has been appointed. And then we will, of course, we will keep you updated. We were not hiding. The only problem, of course, was that we had to do this work since December, and I know that my colleagues have been referring questions, saying that what do we do? Media are asking questions and so on, and I said, wait until we are able to answer. And I'm now confident because we have taken this step to fast track, and we are we really are confident that the timeline that Mr. Dakela has promised us will be met. And we don't want, the last thing we want to hear is more complaints about by the clinicians and patients about the services that they are not getting here. All of us are concerned. As the provincial government, we are very concerned. The national government is concerned, and that is why we have taken these extraordinary measures in order to fast-track this project. Yeah, I dealt with the issue about issues arising. I just thought I needed to clarify that just in case we say this is the budget. Yeah, the SIU, the issue about the SIU, what was it, by the way? Yeah, well, yeah, the SIU conducted an investigation at this hospital, of course, but it was done as part of the proclamation that was issued by the President in August of 2020 to investigate all projects related to the response to COVID-19. So what they have found was that there were serious irregularities in the awarding of contractors for the refurbishment of the Anglo Gold Ashanti Hospital in Carltonville. They are continuing with investigation into other projects. And as soon as they make referrals to us, we will take appropriate action. So we are acting now because we got this report in December. I was mentioning it, I mentioned it because its relevance is to this project was that, as I said to you, the Department of Health and the Department of Infrastructure Development could not agree on the scope of the project and the budget. And we got worried when that was happening. And at the same time, we get this report, and we said we would rather just be safe than to allow this. So if the department says it is not happy with what it is getting there, we can't force the Department of Health to accept the proposals that they were getting, especially in light of the evidence that was already uncovered about irregularities. And so we then had to say, under these circumstances, it is best to bring in another agency to help us implement this project. And that is why we approached the national government, and they were able to appoint the DBSA to help us with this. Of course, Mr. Dakela will be managing the project right through until its completion. And we'll get regular reports from him. He will report both to us, to the Premier, and to the Minister of Health. Because both the Premier and the Minister are concerned about the completion of this project, and it is something that they prioritize. They will be expecting Mr. Dakela to brief them regularly to say what progress are you making. If there are any problems, he would obviously have to report such to them so that they can take necessary steps to resolve whatever problems that we find along the way. Okay, so I'll allow the Dr. Zungu and the CEO to deal with some of the issues about the general, the healthcare, and of course the impact that has.
Let's first start with the CEO, then Dr. Zungu, and then President.
I'm going to first try to address the issue of the impact of the hospital in terms of clinical care. The hospital runs 1,068 beds. We run 52 outpatients clinics every day, and we see about 74,000 patients every month. That's what we used to see pre-fire. And so as Prof. Muyang explained, immediately after the fire, obviously the hospital closed completely. At the time of the fire, we had about 845 patients that we successfully moved to 17 different hospitals. And so there were services that we were sharing with Steve Biko, an example being the radiation oncology. And so it was not possible to take those ones to, say, for example, Chris Hani Baragwana, because they do not have the service. And if you take radiation oncology, our center is the biggest in the whole country. And so it was difficult for Steve Biko to absorb all those patients. And so some of the things that we did in terms of the radiation oncology was that not all patients had to get radiation. Some of them would be going through medication, others would be going for surgery, others would be in the process of being diagnosed. So the doctors sorted and sieved those patients according to the stage where they were. And so the ones for assessments, for example, they were asked to go to Bara to be assessed there, because you don't need those highly specialized to do the assessment, for example. Those who were doing medical oncology, the same patient, remember, can get medical oncology or radiation oncology. So the medical oncology, it was easy to set up at Bara because they are just nearby. All what we need is that we help them to immediately put a pharmacy, the proper pharmacy, that can mix and receive the pharmaceutical services that are related to those type of patients. So the possibility of opening the center was a very important one, because that was the main service that was putting a lot of pressure for the whole province, not only for Gauteng. But as you rightfully say, we do see patients from Northwest and other provinces, not only for radiation oncology, but also for example, renal, many of the conditions. And yes, you are correct, we have some patients being referred from SADC. And so what Prof. Muyang was trying to explain is that the clinicians said, if we have this 25 different services, how do we prioritize those that will have the major impact in terms of those patients not receiving patients? And that's how we opened the hospital first. Each head of department had to look at the type of services that they do and prioritize them according to that. The second thing that they did was that, remember, the area where the fire happened, unfortunately, it's the area where most of these clinics that I'm talking about and the many highly specialized services are located, including the mental health wards. So that actually caused a major impact, because suddenly we lost the 40 mental health beds that we had. And the patients who were coming here had to be accommodated at Helen Joseph Maybe the one little fortunate part was that they had just finished one renovation of a 20-bedded ward, so we were able to immediately activate one mental health ward with the staff from Charlotte at Helen Joseph, but that is not enough. And I think the issue of mental health, all of us know it. And I think I mentioned that even our own staff are going through many challenges. Besides the COVID also led to a lot of mental health patients relapsing and coming back to the hospital. So what we did as the strategy, as we do block 1, the one that is being done by Solidarity, we can't get the 2 wards where they are placed. But when we get block 1, we will be able to open our day ward the ward that we used to use as a day ward observation into mental health. And with that, we have noticed somehow that majority of the patients who have mental problems are males. So there's a discussion going on between the psychiatrists in this hospital and Helen Joseph on how we could keep the male patients, because they are the ones who need more space, and they keep the female patients. But our own psychiatric hospitals, Sterkfontein and Tara, they really assisted in fast-tracking some of the admissions, because as you know, a mental health patient comes to us as an acute. Once we stabilize and they need admission for chronic care, they have to go to either Sterkfontein or Tara. So there've been engagements. We have regular cluster meetings with them to update them on where they are, where we are, and all that. Some of the areas, I'll give an example with orthopedics, the hip and knee replacements. We were fortunate that Bethatoa had spare wards and ICU where we could continue with that work. It's not at the correct level where we want to, because we had a plan to try and reduce the waiting time for the hip replacements, but that was affected. Where there was a major impact was in trauma, because you can imagine if Helen Joseph is a smaller hospital than Charlotte, and the area in casualty where they keep the trauma patients is not, I think it's about less than half of our space. And remember, Charlotte Maxeke and Helen Joseph carry the load from the whole northern side right up to Deep Slot. So the pressure was at Helen Joseph, and it's still at Helen Joseph, together with mental health in terms of that. However, some of the referring hospitals from Ekurhuleni and Western, our staff are still going there to try and deal with those patients as much as they can, like I had given an example with radiation oncology, so that we are able to diagnose. And I think, Prof, what we did is that because we do not have casualty, we even admitted patients directly from the casualty of those hospitals. Because once they assess the patient and they do whatever investigations they can, and they realize that this patient needs admission, we share the information with all the clinical people. They have an access to come directly to the wards and be admitted there. We have also put, there's a helpline, the quality department, when patients ask, and they have a way of dealing with the clinical team to say, must this patient come to Charlotte immediately, or can we refer them to another hospital so that we can be able to capture them? Remember, the patients who come here are many. Some of them had appointments at a later stage of the year. And so as things were changing, we tried to find a way of dealing with those ones. Have we caught up with all of them? The answer is no. We still are trying, because one of the other problems we picked up, for example, when quality was trying to contact them, When we tried to use the phone numbers that were in the, what do you call, the red records, we couldn't find them. But what also gave us a little bit of comfort is that some of them who did not hear anything from us, they brought themselves here. And that's why our outpatients, we are grateful that they are there. We are unable still to accommodate all of them. But if you come in and you say, I haven't heard anything, we find a way. Either we'll stabilize you here, and based on what is it that you need, you will be referred. Because the very same doctors, for example, the orthopods, they are working at Hillbrook, they are working here, they are working at Bethakoa, but some of them are at Far East Rand. So they have that pipeline of saying, this one is relevant to go to whatever hospital that we think we need to have. In terms of the staffing, I think the question was who left? All categories of staff left. And remember, I said some of them were unable to tell whether they left because of COVID or other things. But I think majority of the people who left is the specialty nurses. They are in high demand everywhere. And as we speak, Prof. Mien and Matron were saying, in terms of us opening casualty, we have to retrain quite a lot of them, because remember, we are seeing the very complicated trauma patients that are here. And that's why I said I'm grateful that those who are already in the system, we have started with that training. But we are also trying to recruit as many nurses as possible to come in. From the support staff, we did lose quite a number of them. But with the COVID posts that were created, they were able to assist us to patch here and there and be able to function. So not everything is perfect. There is still a lot of challenges, but we deal with them on a daily basis as and when they happen. Because sometimes we will stabilize this particular department and we find that there's another problem in terms of another one. And so it's a daily assessment of what is happening. I think I have answered all the questions.
My first comment was 68 million.
Oh, yes, sorry.
It was not about whether
Okay.
it's total budget, and it was not about whether it's income. I know it's from the general fund, that I understand. What I'm trying to get clarity on is, in your answer, when you mentioned the 68 million, you said they gave the hospital 68 million, but then you realized along the way that other problems arose. So I'm trying to understand, does that mean those problems meant that you needed more than the 68 for this phase of this project? And were those problems as a result of compliance issues that were brought about prior to the fire from sewage gates, etc.?
Okay. No, thanks for that, for reminding me. Yes, when we gave them a brief of what needs to happen in Block 1, the scope told us we need 68 million. But maybe to take one step back, if you look at the hospital, it has more floors than what you see. In between every floor, there's what we call a service area, where all the structural whatever are based. And one of the new regulations says that space, which used to be an open plan from Block 1 to Block 5, needed to be compartmentalized, so that when there is a fire, the fire should be constrained to the one area. And maybe to give you an example, if this is the casualty, above casualty there's a service area. What was needed, there are special bricks that they had to put that had to withstand the fire for at least 2 hours, so that it can give you an opportunity to evacuate the patients who are there. So they had to count the squares, and just for casualty, just to tell you, we needed 1,000 of those bricks. Now, when we were given the spec, remember there was no that calculation at that time. And when you look at those bricks, they are not normal bricks. So that's what brings the escalation of the price. But the second thing is that, remember, if you take the HVAC or the gas pipes, they were just one long thing. Now, when you put the bricks, you had to now redivert those services. And that's what is leading to extra costs. And that's why Mr. Dakela cannot give you the costs. Because at least the work by Solidarity has already given her an idea on how to do the rest of the other 4 blocks. But what else is she going to find there? As I said, there are other services. We have the biggest NHLS here. They have their own issues. We have a big radiology department. They have, so as they go through the block, they might find other escalations. I hope it has responded to you. I've responded to your question. Thank you.
Thank you very much, CEO. Thank you very much, MEC, DG, HOD, Mr. Dakela. I think, colleagues, we are done, and I think going forward we'll definitely communicate. I think what you said was quite sufficient. But thank you very much, colleagues, for continuing to report on the matter. It is very important for people of Gauteng. No, Dr. Zuma felt that it was
Okay.
sufficient.
It was covered. Okay, that's fine.
Okay, colleagues, good day, and let's see each other later on. Thank you very much.
Okay. Thank you. Yeah, no, you can't be late. You can't be late. Yeah.
Things about the whole, what you
No,